We know that self-harm and suicidal thoughts are very common in children and young people. We have about 1 out of 4 children and young people, according to the last statistics, experiencing either suicidal ideation or self-harming. So in order to appropriately support them, it's important to identify them, first of all, especially because, as I said before, many of these children also experience other kind of mental health difficulties. So some of them may not be able, to communicate properly that they are struggling, for example. So the idea, with this type of paper, with this line of research, is try to identify some kind of markers of, in this case, suicidal ideation, suicidal thoughts, and self-harming behaviors. We are not there yet. So we cannot use, for example, heart rate variability or heart rate to identify those who are more at risk, for example, of developing suicidal ideation. But what we can do, and this is actually why it is important, we can work towards understanding if heart rate variability can be used in clinical practice as an objective marker of mental health and well-being. For example, to see, okay, if I try, intervention A or this specific management support strategy, does heart rate variability change? Because if heart rate variability is a kind of a marker of mental health, mental well-being, maybe we would be able to understand, more efficiently and more accurately what intervention works best for that specific child, that specific young person.